Okay, I seriously love hosting this podcast. And one of the biggest surprises has been the amount of support that we have received from all of you, our listeners, and our amazing sponsors. We have partnered with Promise Grounds, a Texas-based company that also supports global mission by giving clean water ounce per ounce. They provide everything in our studio, from K-cups to fresh coffee beans to all of these adorable cups that we use on set. One of my favorite things to do is personalize each of these cups and recite scripture over our guests before we start recording. If you want to check out these adorable cups and some amazing coffee, click on the link below in our show notes and check out Promise Grounds. Click on the link below in our show notes and check out Promise Grounds. Hi, girls. Welcome back to Unfiltered Grace and Truth. Today, I have my new friend, and her name is Gina, but we like to call her Dr. Gina because she earned that title. And she is a pelvic floor specialist, which a lot of you who have either experienced birth or infertility will need to listen into this episode, because we're going to get into the nitty gritty, and we'll probably say vagina more times than you're expecting, because that's part of it, right?
Yeah.
Pelvic floor and vagina are like apples and bananas.
Yeah.
Great. Yep. They go well together. So we're going to talk about it. We're going to talk about all the things. So Gina, how long have you been doing pelvic floor therapy, physical therapy?
12 years.
Wow.
12 years. Yes.
Oh my gosh. I have a story for 12 years. I'm going to save that for later.
Okay.
That's what I got my Bible for. It's a 12-year thing. Why did you go into it?
Well, funny story. I have crazy student loans from grad school.
Yes.
And I needed to work for a nonprofit for some loan forgiveness. And so a company was hiring that was a nonprofit. So when I went in for the interview, they're like, do you want to do pelvic floor? And I was like, ooh, they're like, if you want the job, you have to say yes.
Wait, what did you go to school for originally?
To be a physical therapist. But at that point, I wasn't specialized in
so
pelvic
it could have
floor.
been anything. Did you have a specific thing that you wanted to do?
It was just outpatient. It was anything from ACL sprains to necks to wrists to ankles.
The whole body.
Yeah, the whole body. Anything.
But then they're like, hey, we got a specific area that you get to focus on. And
yes.
You're like, yay.
Exactly. So I kind of was just thrown into it, and they paid for all my continuing education classes through Herman and Wallace. And here I am.
Do you still work with them or associated with them?
Yes.
So you
I
still
work per diem for that hospital. Yeah.
That's amazing.
Yeah. And I love it. Yeah. It's so flexible.
We had another gal on who started chiropractic school because of a friend, and they just got like introduced to it at the end of school, and they're like, I think I'm going to do chiropractic care. And so it was kind of how it worked out for her. So pelvic floor physical therapy, what does that entail?
That's a good question. So I treat all pelvic floor dysfunction, from constipation, incontinence, prolapse, pelvic pain, pain with intercourse, and the list goes on and on and on. And
sciatica. SPD that I had during my pregnancy. It's
yes.
It's called fire crotch.
Yes.
Very painful.
Anything diastasis rectus, anything pregnancy related, postpartum related.
Infertility.
And fertility. Now the fertility thing's a specialty.
You went to additional school for that? Okay. Why? And what does that mean?
Yes. So this special training I did in 2022. It's called Mercier Therapy. It's a very specific technique that Jennifer Mercier out of Illinois created. And it's following a very specific protocol in order to have all of the clinicians do the same approach on their patients. Here's the medical jargon. It's deep gynovisceral manipulation of the reproductive organs. What that means is I'm pushing and moving around the uterus and the ovaries and surrounding tissues externally. No internal work with Mercier Therapy.
Okay.
Yeah.
So a lot of that is inflammation or blockage or just like fascia?
Yeah.
Skin that is just collected over time, and that you're just kind of making space for your organs to actually work properly. Yes. So the difference between chiropractors, they're doing a manipulation on the spine, and physical therapy is more muscular.
Yes, that's a good way to put it. Yes.
Okay.
Yeah.
I'm third grade level here. About.
And Mercier Therapy is specific to fertility or endometriosis, PCOS, and treating these fertility related things to help break up scar tissue, increase blood flow and circulation.
So do you encourage like diet or acupuncture, any other form of holistic support with fertility?
Yes, 100%. We'll talk about some nutrition aspects and some all over wellness, right? Like emotional well-being, stress levels, cortisol, helping them get testing to check out their hormone levels. And if they need to go the naturopath route or acupuncture route.
So what would that be, like a Dutch test, which is like the hormones and stuff?
Yeah.
So really just kind of like understanding your levels, where they're at, and then either supplementing with something. What about perimenopause? Do you work with that a lot?
Yes. Yes.
So one of the things I heard about perimenopause, and this is so unfiltered. So I hope my female guests are listening and the male guests have already tuned out by now. But like, I don't know why I even know this, but there's like a dry, vaginally, like sex is really difficult. It gets very dry. Like, so I've heard certain things that are like symptoms when I was looking up perimenopause. So does physical therapy help with maybe not the vaginal stuff, but like what does it do for perimenopause?
Yeah, that's a good question. It's pretty much, we promote HRT, like hormone replacement therapy. We really, really encourage women at around the age of 40-ish to start maybe low dose estrogen or something to prevent all those menopause type symptoms.
Which would be hair thinning, hot flashes,
vaginal dryness,
brain fog,
you
know, all the lovely things. When you go to the doctor, they can't really test and they're like, your labs look okay. So come back next week, come back next month, maybe try this supplement. Some things are off, but we have this huge range and you're kind of within the markers. So physical therapy would be something if somebody's experiencing infertility or wanting to be more fertile in their relationship. And then perimenopause. I never would have put physical therapy with perimenopause.
And plus just helping with the symptoms of leakage with coughing, sneezing, laughing, and all of those things.
Tell me more about that.
Yeah.
That sounds like
jumping
a good
on the
topic.
trampoline with your kids.
And you just pee yourself.
Yeah. So
How
that's
fun.
like the pelvic floor PT route.
I love that. One of my really amazing friends, she was my boss, and I won't say anymore because people know her, but she had to do like the mesh thing, and she got an infection after, and like it was awful. But she went for that surgery, and that's pretty intense surgery. So there's a mesh, something they can put in there to help you not pee on yourself.
Yeah, usually it helps lift the bladder. But
fun.
It would be better. It'd be better to have pelvic floor physical therapy first before you go into surgery, like conservative measures first.
So cheek lift, bladder lift. I mean, we can lift it all these days. Like it's so fun. Like, so are you grateful for this opportunity to go into the pelvic floor from PT? Like, did you like aspire to be something else? And you're like, well, I've already just been here. Or are you just like thriving in this area?
Just thriving in this area. I love it. I love it. It's so rewarding because women are like suffering for years and years and years with whatever pelvic floor dysfunction it is. And then we get to see like such a dramatic change for the better. Women waking up 20 times a night to pee because they have overactive bladder to being able to actually sleep and only waking up once or twice. So just these big life-changing things, and people just come to you unable to have intercourse because of pelvic pain and all of these traumas and scar tissues and whatever's going on, and we're able to help
scar
them.
Tissue C-sections? Or just your body producing tissue and like
C-section
lack of
scars.
movement?
Yeah, any lack of movement. Endometriosis is a big one.
So tell me what endometriosis is.
It's when the blood supply is growing outside of the uterus through the other tissue. So it can even go into your testes. It can even go all the way to your brain.
Oh, is that like cause brain issues?
No, it
brain
doesn't
fog
cause
or
brain
anything?
issues. It can cause brain fog, yes.
So your uterus for your period would collect all of that, and then you have a period and it flushes your uterus. With endometriosis, it stays on the outside and doesn't flush. So it's
usually it flushes. Usually women with endometriosis have heavy periods, painful periods.
They just collect
really
more.
Yes.
So their whole uterus fills to the overflowing.
Yes.
Their cup runneth over.
Yes, it does.
Sorry. I cannot drink any more coffee. This is such a fun episode. I'm like on one right now. Okay.
And for Mercier Therapy, we can't do the Mercier Therapy treatment when they're on their period because we're helping to break up scar tissue and increase blood flow, and we don't want to make symptoms worse. So we wait until they're not on their cycle. We can only treat.
So with endometriosis, what do they need? Like heating pads and like, is it really bad cramping? Just a lot of blood flow?
Yeah, and everyone's signs and symptoms are so different.
Okay.
Lots, inflammation and
This is so fun.
Yes.
Let's talk here for
Let's
a second.
talk.
This is so cool. So if you know our story, my husband and I have been trying to conceive a son for 12 years. We've been married. Well, our 12-year anniversary is next month, 6/26. Or this month. Is it June?
Yeah.
We're in June? Okay, this month.
In 10 days.
In 10 days. My wedding anniversary for 12 years is 10 days. And I went to this church up the street here in San Diego, and they had a bunch of pictures. And I took a video. It's like all these pictures laid out. And they're like, pick the picture that speaks to you the most. And I looked through and I didn't know what I was supposed to do. I just saw the pictures and I was like looking at them and I was like, wow, that one is just like resonating. And then I read the directions, it's so backwards. But anyway, it was the woman who was on the floor, basically crawled to the hem of Jesus to touch the hem of his garment. And I was like, why does this picture resonate? Like, it's such a desperate attempt to reach just the hem of his garment and having the faith that says, like, I know that you can heal me. Nothing else has worked. Now I'm like, okay, I'm sitting here and it's like this silent moment with Jesus. It's like 3 hours and you just kind of sit and meditate and they give you like art and stuff. And so I had seen that picture and I picked it up and I was just holding it and I went to find the Bible verse for it. And it's in Luke 8, 20, what's going on here? 21, 22. It says, as Jesus was on his way, the crowd almost crushed him. The woman was there and she was subject to bleeding for 12 years. No one could heal her. She came up behind him and she touched the edge of his cloak and immediately her bleeding stopped. Who touched me? Jesus asked. When they all denied it, Peter said, Master, the people are crowding and passing by. Like, dude, what do you mean? Like, there's so many people here. Who touched you? We don't know. And Jesus said, someone touched me. I know that power came out from me. And the woman, seeing that she could not go unnoticed, came trembling and fell to his feet in the presence of the people. She told him why she touched him and how she had immediately been healed. Then he said, daughter, your faith has healed you. Go in peace. Like, how cool is that? And my 12-year anniversary is coming up with my husband. And so I was like, oh my gosh, what if we got pregnant, like at our 12-year mark? Like, this is me, that woman. I had no idea that there was 12 years. Like, I didn't know. You've been in your business for 12 years. Yeah. We were just talking about like endometriosis and just like this bleeding that is like obsessive and like crazy and difficult. And like, she just reached through the crowd of people, like crawling on the floor. And when you're bleeding in that time, like you would sit in the river and let your blood flow from you. You were like unclean. You couldn't have sex. You couldn't be touched. Like your blood needed to flow out of your body. And so this poor woman, I mean, she probably looked like a raisin. How many times she gonna be sitting in that river? They didn't have tampons and pads. This poor woman is just probably like unclean. You're unclean in your period in that time. And so now we have like 28-day cycles in 5 days. And that's the hope. And that's the schedule. And we have tampons and all these gadgets now to help with bleeding. But this sweet woman was there and like he healed her and he felt that power come out of her. So talk to me about like faith in your practice and the women that come in and the infertility stories and just like what that experience is for you to be like attributed to a healing that is so divine.
Well, with Mercier Therapy, I do in-home visits. So I bring my massage table and all my things to someone's home. And an amazing story was last summer. And after sessions for Mercier Therapy are once a week for 6 weeks. It's about a 45-minute treatment.
4 to 5 or 45?
45, okay. 45-minute treatment. Yes. And, so after last treatment, I know this client of mine is Christian and, she's been struggling with infertility for about 2 years. And so the last session, I get to pray with her, pray over her. And it was just so beautiful. And then 3 weeks later, I text her, hey, how are you doing? How are you feeling? And she's like, well, I'm not feeling good.
Uh-oh.
Because I'm pregnant.
Yay!
And I was so happy for her. And now she has a healthy baby boy that looks like her little mini me.
Oh my gosh, that's
yes.
amazing.
So that was so awesome.
So how did she get to you? Like a friend of a friend? Like how would somebody find out how to find you? Obviously here in the San Diego area, like let's promote you all we can. But like maybe some of my friends in Texas who are struggling with infertility and they're like, well, I have endometriosis or PCOS, or I'm struggling with certain things that are really difficult. How would I know to find a physical therapist? What do I ask for?
Right.
Mercier. Sounds
yes.
Like very bougie.
French. Yeah,
I was going to say French. Mercier.
Yes. You can go on the Mercier website and it'll give you a list of practitioners to say like by state.
Oh, that's cool.
Usually here it's just word of mouth, just friends of friends of friends, whoever can.
And why do you do it in their home? Just because it's such a personal thing, or it's easier? It's timeline. What's the schedule?
It's more just easier on me to not have to worry about them coming over to my house and childcare and everything on my half. So it's just easier for me to go to them. But it helps with people that are doing the IVF route also.
Okay.
Like if that's their plan, or let's say I had this amazing Christian couple, I think 2 summers ago. I actually knew him because he's a PT also. They did IVF once and it failed. Mm-hmm. So that he reached out to me, and they still had, of course, embryos they wanted to use. And so they had a timeline of when they wanted to start. So they sought out me. We did some treatments. We only got through 4 of the 6. So we didn't finish the complete timeline. But after that, the next IVF transfer was successful. So
the Mercier,
I know.
I had to take French in college or high school. Sorry, in Tunisia. I went to North Africa for high school. But
my goodness, that's amazing.
It's really just the blood flow.
It really is. It comes down to getting everything in here to work optimally.
Optimal.
Yes. Yeah. And even women, I had a lady, her daughter was on my daughter's soccer team, only had 1, wanted more, never able to have more. So I worked with her. Sadly, she didn't get pregnant again, but it changed from her periods being so heavy. She was on medication because her bleeding was so heavy to her being able to get off the medication because it helped just kind of flush everything out. And she had endometriosis, and it just really helped decrease her bleeding and the intensity of the pain and discomfort.
So when you tell people what you do, have you gotten any like funny questions? Like, what do people ask you? Like, I'm pretty unfiltered, so I'll just say what I think. But what are some funny things people have asked you about your job, or like questions they've had? Like, I'm curious what people think of what you do.
I know. Well, it's kind of 2 different things, right? Pelvic floor physical therapy is treating pelvic floor dysfunction, and then the Mercier Therapy is going more like the fertility route. But with pelvic floor physical therapy, let's say I was doing it for like 10 years, and my best friend knows I do pelvic floor physical therapy. She knows all about this stuff. And it wasn't until like 8 to 10 years into it, she's like, oh, you do internal pelvic floor assessments? So
do you?
Yeah.
What the heck is that? Is that like a pap smear?
No.
Oh gosh, I'm like, wait a second, what do you do?
But a pelvic floor physical therapist is the initial evaluation. Whether I'm doing an in-home visit or you're working at a clinic, you put a glove on. I wish I brought my pelvic model. You put a glove on, a lubrication on one finger, and
that's
you are looking.
Pap smear.
Yeah, but I'm not using a device, and
You're not doing like that thing, but like where they like crank it open. I'm like, okay, when are we stopping here? It's like the worst carnival ride sound ever.
No, I'm checking for muscle strength. I'm checking for pain, pelvic pain. I'm checking for strength, endurance, coordination to see how well your pelvic floor muscles are working.
I am cringing right now. Why is this so cringe for me?
Oh my gosh,
it's human nature, but I'm just like, so are you like a Kegel master?
Yes, I am. I am a Kegel master. I will teach you how to do your Kegels.
Okay,
correctly.
Teach us. Okay, everybody listen. Get your notebook. We're going to Kegel.
Okay, sit down.
Okay.
Both feet flat on the floor. Now, okay, the only true way to measure this is probably with an internal pelvic floor muscle assessment by a physical therapist, because
that sounds fancy.
I know, because I could say do a Kegel and you could be doing it wrong and we wouldn't know unless I assessed.
Did you bring your gloves? No, it's getting wild. Okay.
So, think about those pelvic floor muscles. So that bowl of muscles that help to support the bladder, the uterus, and the rectum.
Oh, my
bowl of muscles.
Okay,
yeah. Okay. And you're going to focus on lifting those pelvic floor muscles up and in, like you're either stopping the stream of urine or stopping from passing gas. Because if you feel the anal sphincter moving up and in, you're doing it right. But if I see movement, you're using glute max, and we don't want that.
Oh.
So just like
this couch is going to give me away if I'm using my butt cheeks.
Yeah.
Okay.
So you're just trying to small lift of the pelvic floor, like you're trying to hold in urine or hold in from passing gas, if those verbal cues work for you. And if they didn't, then of course I'll give you lots of different verbal cues. But
every husband just thanked me for this episode.
Yes.
You're welcome, bro.
Oh my gosh, I love it. I love it. Love
Okay,
it.
so we're Kegling right now and you have no idea.
Yes.
Wait, do we do this? So somebody wants me to do it at every red light.
Yeah, that's great.
So mascara or Kegels, but get your workout in, girls.
Yeah. You could do long holds. You could do short holds. You could do fast. You could do slow. Change
Is
it
my
up.
eye twitching?
You're really, really concentrating right now. But Kegels aren't good for everyone. So that's the hard thing is Kegels aren't always the answer. So if someone
What are Kegels even for?
to strengthen the pelvic floor. Because it's just
So
like
that
you're
you
doing a
don't pee or so it feels better for sex?
both.
Okay, great.
Could be
I
both.
love that. It
Could be a lot of
depends.
things.
I love that.
A lot of different things.
So I can jump on a trampoline now? Or should I wait?
It doesn't happen that fast.
All right. Sorry, girls.
But you also got to strengthen the glutes and the core and everything supporting that pelvic floor in order for it to work in a coordinated manner so you can start jumping on the trampoline.
Okay. Well, I got some work to do. We're going to cut this short. No, I'm just kidding.
We got to go do some pelvic floor.
Okay, so
PT
you're
right
a Kegel guru. That's what you should
Yeah.
put on your resume, like Kegel guru.
Oh my gosh, I love it. I love
That's
it.
so fun. Okay,
Yes.
so what other things can people do that like strengthen core muscles or like, is it like stomach or it's internal? Like what are some other
I
little
know there's
tricks?
such loaded questions. There's so many things. We could spend hours talking about all the things. But yes, okay, so you have your six-pack abs, right?
Oh, yes.
Your core.
Yes, but the spectorectal, what is that thing? Where it like splits? Your rectum.
Oh, the
is-
diastasis rectus?
Yeah, I was close.
Yeah, that was so close. I love it.
So what is that? When people have that, that's during pregnancy?
Yes.
Or
yes.
what if they're just chubby?
Yeah.
It could be
Do that.
chubby.
Yeah.
So anytime
Or
you
like-
have like excess weight in your stomach,
Yes. You can,
your abs can't contain it and they split open like a banana.
yeah.
Coconut?
I feel like coconut would be hard to split open.
Okay. So it splits open.
Right.
And fat basically protrudes through or something, your organs.
It can if it's really bad. That's why you want to prevent it from happening.
And that happens and that's people come see you for that?
Yeah. Yeah.
And you kind of train their core to strengthen and to go back into place?
Yes. Yes. So in pregnancy, you can't really help it. Like it's going to happen no matter
Yeah.
what, because your belly's going to grow and your rectus abdominis, your six-pack abs are going to separate no matter what, especially like twins, multiples, right? It's going to be
Does everybody have six-pack abs and you just can't see them? Because we all got
there.
them?
They're all
All
there.
right. Well, I haven't seen mine in a while. All right.
So no matter what, they're going to expand.
Yeah.
And so some people, it just comes back together easier than others.
Yeah.
And so you have this like fascia that's holding it together. But if you're pregnant, you might see like coning or doming if you go to like sit up.
Yeah.
That's weakness. So we don't want to stress that coning or doming because it's just weakness between the muscles. So
It's not the baby. It's not like their foot or something.
They're all
or like,
protected in the uterus. And they're
okay.
safe in
So
there.
that
Yeah.
is just like the baby's pushing through and that's kind of splitting open. So obviously you don't want to do sit-ups. You don't want to sleep on your stomach when you're pregnant.
Yeah,
you
no
don't want to
crunches,
really,
no sit-ups.
but these are great things to do before getting pregnant to strengthen those muscles.
Yeah.
If you don't
yeah.
have a
DR. Diastasis rectus. Yeah. Yes.
So it splits open and people come in and say like, hey, I've been doing sit-ups. I'm doing all this stuff. And you can actually kind of see that little like separation. So this just kind of separation that happens during birth. It happens if you've kind of gained some weight and there's ways to kind of strengthen your body and giving it. So one of the things we talk a lot about on this podcast is like the advocacy for a woman is to just really advocate for their body and to really know that, yes, IVF, in vitro, IUI, like there's some scientific things that can help. But even to your story that you shared, it's like science can only take us so far. Then there's obviously the sovereignty of God and then the capacity in which your body can or cannot handle that pregnancy. Right. And one of the things that you talked about is kind of like this mind, body, spirit. Like it's this whole encompassing, like you really have to get your mind right, your body right, and then like your faith and your spirit right, so that all of that would be this beautiful place to welcome that baby, you know? And some people have problems getting pregnant. Some people have problems staying pregnant. And there's all different like facets of it. So at what point does somebody come and say, hey, I really want physical therapy support or pelvic floor support in order to conceive?
Right. I would say from the beginning, if you're thinking about getting pregnant, whether it be natural IVF, IUI, whatever route they choose to go, it's just as a means, first come with conservative treatment first, so that we can work on you and see what's going on. Because then we'll talk about your cortisol levels and how to decrease your stress and lifestyle changes and maybe some diet changes that you can make. And hey, maybe decrease the caffeine intake and
I'm twitching. Let me say something about cortisol that I just heard.
Yes.
This is so stupid, and I do it all the time now. I haven't told anybody this. And I do methylated blue.
Oh, mm-hmm.
So my tongue might be blue, and I just had some cherries, so it might be purple. But what I heard was that if you stick your tongue out for 40 seconds, it decreases your cortisol level.
Oh.
And I wake up at 3 o'clock in the morning. I used to have this problem, and I kind of cured it, and I got better. And now again, here we are, and I'm on a different time zone. I'm up at 3, and I was like, I bet it's my cortisol, or I have really low blood sugar. So I have a glucose monitor, and I have nocturnal hypoglycemia. So it wakes me up in the middle of the night. I try not to pee, and then if I pee, and then I'm like, okay, I'm up all night. Here I am, like trying to spend time with Jesus. Like, I'm like, okay, listen, if you're waking me up at 3, like we could do this at noon. Like, let me sleep, right? Anyway, so it's obviously something wrong with my body, but I do use it time with the Lord. But I've been laying in bed for like, I'm up to 2 minutes now. I can stick my tongue out. It's really painful at first. My jaw was hurting, my neck was hurting, but you stick your tongue out and you just let it dry out the cortisol that's saliva producing in your mouth.
Really?
Is that crazy?
Wow.
I mean, I'm willing to like jump on one leg and do Kegels at red lights, stick out my tongue. Like I'll try all the natural things possible. I don't know if it works, but look, Jen's got her tongue out right now. But it supposedly like dries out the cortisol. Have you ever heard that?
No, I have not.
I love the tongue. It's like the craziest thing. And then I know like a bunch of like Chinese medicine, like if you have ridges, like bumps on the side of your tongue here, that's from your liver being inflamed because your teeth, your tongue is like inflamed. So it's kind of sitting on your tongue. So your teeth kind of imprint on it. And then your stress is this deep line down the center of your tongue. If you're stressed, it's like a very deep line. Or candida.
Oh, yes. Yes.
So the mouth can tell a lot. But anyway, you were talking about checking cortisol levels, and that's the Dutch test. Or do you do other cortisol, like where you spit in the cup?
I'd probably recommend like different things, but a lot of the women have already done a lot of their own. They've done a lot of their own things before they're reaching out to me. Are you their last hope? Sometimes, yes, sometimes it's true. So they've done a lot of things, but I try to just coach them in ways to decrease stress, whether it's deep breathing or decreasing some inflammatory foods.
What kind of coffee do you drink?
Bad coffee.
Oh, really?
Yeah.
Are you an 80-20? Like 80% good, and then you got your 20 Starbucks in there?
Yeah.
Yeah, I pretty much 80-20 too.
Yeah. I mean, I drink organic coffee, but not at Starbucks.
Look at these new cups. They have these new cups. The iced coffee now comes in cups like this. It's awful.
It's only because we're in Carl's.
It's awful. This is how they serve iced cups in
here,
San Diego, and
not where I am.
Oh, well, wherever I went. And the ice was all the way to the top. It was like Sonic ice, which was lovely. But I was like, dude, there's 3 sips of coffee here. And I had just gotten in my Uber. I was like, can't even go back.
Oh.
So, yeah.
They're bladder irritants. We're just drinking our bladder irritants.
Yeah. Oh, is that what that is? Tell me more.
Yeah. So if you do have urinary leakage.
Wait, what? If you have what?
Like urinary leakage, incontinence, or overactive bladder where you're peeing all the time.
Okay, wait. Urinary continence?
Urinary incontinence, leakage, urinary leakage.
What causes that?
Oh,
age?
A lot of things. Age, pelvic floor weakness.
Is this the trampoline situation?
Yeah. Back to kind of that.
Or just like you're walking and all of a sudden you pee.
It could be that. That's a little more extreme.
Or you're laughing.
Yeah. Laughing, jumping, coughing, sneezing.
And so you're wearing a pad, or like people know that they have this, or
usually they know. I mean, or
you probably find out once, and then you're like, okay.
Yes. So coffee, bladder irritant. Alcohol, coffee.
Coffee, is it bladder irritant?
Yeah, because of the acidity and the caffeine. So acidic. It's so bad for your bladder. It's a diuretic too.
What does that mean?
Like it makes you have to go more often.
Wait, why are you saying 3 different names for the same thing? We're just all peeing on ourselves, and you just had like 14 names for that. Right?
Yeah.
So I know at Target and Walmart, if you want to sponsor me, company, I don't know your name, but they have leak-proof panties that have these things in it. They're like leak-proof. They're for your period. They have like something in it. It's leak-proof. So if you have incontinence.
Yeah.
Isn't that a name? Continence?
I guess it could be someone's name.
Continence? Is that a name? Anyway, if you have this leakage, they have panties for it. Yeah. Kegels. See a PT, physical therapist, PT. Funny. Anyway, what else? What else do you do for? I was going to say leaky gut, leaky
bladder. Yeah, for incontinence. I will tell people how to strengthen their pelvic floor because we'll do an internal pelvic floor muscle assessment, right? Love lubrication.
No cranker. Crank-free examination. I should do your marketing. Like,
yeah, you should.
Kegel guru. I mean, we got all of this.
I love it so much.
For the third grade level.
Yeah. Decrease bladder irritants. Strengthen your pelvic floor.
So stop drinking coffee. Do your Kegels. Strengthen your floor. And it gets obviously worse with more pregnancies, more deliveries. Does a C-section affect that as well?
Yeah, I guess everyone's different. Someone could just like not have any babies and still have leakage issues. So it's not that we can't blame our children.
Oh, dang.
Darn.
I thought I would totally blame them.
Yeah, but does pregnancy make it worse? It can, but not always. It just depends on the person. It depends on how strong your pelvic floor is or how coordinated it is.
How coordinated is your pelvic floor? What a question. I've never thought. I mean, my planner's not organized. I'm sure my pelvic floor is a hot mess.
Oh my gosh, I love it.
How organized? What was the question? How
coordinated?
Coordinated is
your pelvic floor. Do you know how to contract the muscles and relax the muscles correctly?
Just did it.
Or some people don't.
Can you see it moving?
Nope. Not past the Bible.
How about my tongue? It's working with my vagina right now.
Clenching everything.
Yes.
Just tighten up.
The clench. Does it happen to your like sphincter muscle too?
People have fecal incontinence also, but that's
Is that part of your genre?
Yeah, I still do that pelvic floor. Yeah, still pelvic floor dysfunction.
It's messy. It's a messy job.
Yeah, it can be. I mean, I'm not usually dealing with people when they have leakage issues. I'm helping them prevent it from happening when they're like at home. Like because they have the pelvic floor weakness and because they have all these other things, and a lot of times it's diet. You know, you find out people
helps. Acid causes more leakage?
It can.
Or like have to go to the bathroom and stuff?
Yeah.
So what are some acidic things? Coffee?
Like
things that people wouldn't normally think. Like you would think a tomato or certain things.
Right, like alcohol.
Alcohol is acidic? Okay, what else?
Citrus, of course. Tomato products.
Things that cause heartburn?
Yeah, that's a good way to put it. If it causes heartburn, it's also acidic for...
So margaritas.
Yeah.
That's probably going to cause you to pee yourself.
Yep, the alcohol's a big one.
Yeah. Oh, wow. This is incredible. I have not even thought about
Sparkling waters can even be our bladder irritant also.
Oh, what kind? All of them?
All of them, because they're carbonated.
Shoot. I love bubbles.
Yeah.
Like I don't drink alcohol, but I do love sparkling water. It's like every meal for me. Oh, I need that company to get me those panties. We're going to have a problem.
Hook her up with those panties.
Yeah, I call them period panties or leak-proof panties or whatever. Wow. Okay. Give us some more little nuggets. Like, what are some things?
People that are suffering from constipation. So if someone has constipation, pelvic pain with intercourse, there usually can be a like higher stress or a higher tone in the pelvic floor, like a high stress person, higher tone. So that's when Kegels are not good. Because you already have so much tension in the pelvic floor, you have to learn how to down regulate.
Okay, I have something that I can associate that with. After I had my kids, all three of them, I really had a lot of high anxiety. And we were at a hotel. My baby was like 3 months old, the last one. And I remember I grabbed the ice bucket and I had to leave my kids for a minute to run down the hall to get ice. And I ran. And by the time I got to the ice maker, I was so full of adrenaline and like anxiety. Like I walked back to the room. I was like dizzy. My hands were shaking. Like running was a terrible thing for me because I have anxiety at that time. Like I obviously worked through so much mental health stuff, but just running was a horrible thing for me with anxiety. So if I wanted to exercise, I couldn't get on an elliptical and like feel good. I would feel like I wanted to die because I would have so much energy. And it's similar to kind of like what you were saying is like, certain things, like if you have that high stress, those Kegels are really going to add that stress to your body.
Exactly.
Knowing your body, knowing what state you're in, because
that wasn't a permanent state of anxiety.
Right.
That was just, we were traveling. I had 3 kids. Like I had to go get the ice. Like I was living in a very stressful state.
Mm-hmm.
And so I can run now and not freak out. But at the time that was not good for me. So just knowing your body, trauma. What about like, I mean, I'm going to take it to like another pretty emotional level, but like sexually abused either as a child or as an adult. Like if you were raped or dealt with like physical strenuous things. So sometimes for me, I think like pain during sex is like your body's inability to relax in that moment. Mm-hmm. But then there could also be other things like the dryness or sensitivity, things that you work with. So let's talk to the girl who maybe has dealt with some sexual trauma. And so, you know, if she wants to be intimate with her husband, it's like every night she has a headache because it's just too much for her to physically comprehend being intimate to the point where her body could relax. Mm-hmm. So that is, I wouldn't say like a self-induced pain, but definitely like trauma-induced. Yes. And it sits in our body, like the body keeps score book. It's very technical. It's kind of like you. It's very like high level. Like he's talking about all these like things and I'm like, I don't know what that means, but it sounds really cool. So like our body holding on to some of the trauma, some of those like mental things that we carry really do affect intercourse and our ability to just enjoy what God had gifted us with. Mm-hmm. Here's a Jen. Okay.
So of course, coming from trauma, your nervous system is all out of whack. So learning how to downregulate your nervous system is something that we do focus on. So downregulating that central nervous system with breathing techniques and slowly progressing. So it might be working with the partner and the patient to do slow, light touches, to ease them into things, to teach them techniques that might help. But also there are things like if you're not having intercourse for a long time, these vaginal tissues can get really tight and then it can be really uncomfortable. So sometimes recommending dilators, which are these things like silicone or plastic things that you could stick in vaginally and you're leaving in there for a certain amount of time to help stretch out those tissues too. So someone does have actual pain. Those can be something to where it doesn't feel quite as threatening, but you can use that for long-term, well, like 10 minutes, a few days a week to stretch out those vaginal tissues and to try to work on your breathing, down-regulating while you're stretching those tissues. But it's really just down-regulating, being comfortable too.
Do people come in knowing that it's trauma that's causing it? Or do they discover that with you? Or is it kind of both?
I feel both. I feel like most of them come in knowing already.
But it's not,
yes.
Are they associating like this is probably because of this? Or do you kind of have to lead them to that place of saying, do you have like a form that they fill out that they're like, have you experienced sexual trauma?
If I'm doing, no, not necessarily. No, especially not in the clinic because our forms are so outpatient based that they're not like pelvic floor specific. But some places do. And of course we ask these certain questions.
If you get to that kind of place where it's like, okay, so
if that's the direction it's going, kind of see,
and then
we'll ask those questions.
Suggest talk therapy or other certain things for them as well, or like mental, like kind of offloading some of that mental strain that they've tried to bury and just letting their body relax, meditation, acupuncture, just like kind of putting your body in a place where it's like, okay, I can receive this and this is okay and I'm safe and this is somewhere I can relax. But I'm sure there's probably some major trauma that you can't really cure right away. Like it will take time. And I love that you mentioned both the husband and the wife, like the man and the woman. Like it's not just all on her. It's bringing them into like making sure that they're connected in that way. So that's really cool.
Yeah.
What else? What else about PT? Any other cool facts?
There's so many things. Okay, after a baby.
Yeah.
Okay. Okay. Let's talk about this for a second.
All right.
My number one recommendation for every person, what they need as a pelvic floor PT, squatty potty.
Oh, I love my squatty potty.
Yes. Everyone should have a squatty potty.
Yes.
Because it's, okay, we sit on our beautiful toilets with our feet flat on the floor, hips and knees at 90 degrees.
Okay, if you're not watching, we're practicing our squatty potties.
So, beautiful toilets that we have. It's not the ideal
porcelain throne.
Yes. Not the ideal posture for going to the bathroom.
A bowel movement.
A bowel movement. Yes.
Look at me.
Because in third world countries, how are they having a bowel movement?
In a hole.
Yeah, they're squatting in a hole on the ground. And that's the way we're supposed to be. squatting with our knees.
My kids are professional.
Yeah, our knees should be higher than our hips. So we need to have our knees up higher. That's why the squatty potty is so amazing, because we want our knees up, because we need to open the pelvic floor. Just like when you're having a baby and birthing, you gotta bring those knees up to open the pelvic floor. So for bowel and bladder to come out easier, you want to have your knees up high.
What if your bowel and bladder already come out easy because you've got the leaky
gut or ulcerative colitis or all the things?
The urine situation where you pee on yourself. Do those people need a squatty potty too? Does everybody need a squatty potty?
Everybody needs a squatty potty.
For poop.
Yes.
But pee, well,
it can go either way, but it's still lengthening. Yeah, it's still lengthening the pelvic floor, so it's still making it easier to urinate too. Because if people have high tone in their pelvic floor, like we talked about people with constipation, pelvic pain, like type A stressful people, they sometimes sit on the toilet and it takes them a second or two for the urine to like start the flow because they're so tense. So if you have a squatty potty, it's lengthening those muscles, so it come out easier.
We travel so much, my husband and I, and we used to have a fold-up squatty potty, but now we've realized that the trash cans in the bathroom work perfectly. And we it's like a little round trash can. You just put your legs up like this.
Yes.
And we squatty potty. It's like, it's small, so it's like this big.
Perfect. Pelvic floor discussion picture.
But it's like around like this big, and we just use it. I mean, if you don't have a squatty potty, which is a brand,
it's just a brand.
Makeshift pile of books, a suitcase, a chair, just bringing your knees up above your hips, basically, so that you can expand. So I have a crazy story when I gave birth to my third daughter. Natural birth, third kid. We get to the hospital at like 8:30 p.m. They're like, what kid? I have my insurance card and my driver's license. And I'm like, it's my third, and I'm actively contracting. So we walk into the room, and I'm progressing, but all the activity to get there, it's like slows down. And then it starts progressing again. And I wanted to give birth. Sorry, this is so graphic. So I don't know who's watching this still. If I haven't grossed you out yet, here we go. So I'm like on all fours. And the bed is split here, and my knees are down here.
Oh, that's
like
so good.
Yeah. And the midwife's behind me. And thankfully, my husband, I couldn't talk, but I was like, bro, what are you looking at? Get up here.
Right.
So he gets in front, and I'm like this, birthing my baby. No, I had an IV in case of an emergency, but it wasn't plugged into anything. And she says, spread your legs just a little. She's like right there, like you're there. It's like 3 more pushes and I'm going to have this baby. And as I do, it is the most excruciating pain that I stand up onto the bed and I give birth. The baby drops out from underneath me and she catches her. And my husband's like on the other end, like looking through at the doctors. He catches the baby. And I stepped on my IV cord. So there's blood, there's baby, there's a umbilical cord. Like it all just kind of like happened. But the gravity and the pain, like I opened my body and it was like, here she came.
Wow.
And she's
That's amazing.
All of them that were in the room were like, there was only one other time in all the years that we've all worked here together that somebody gave birth standing up on a bed. And I was like, do I get an award? Like, I win something? They're like, you have your baby. And then I asked for like the oxygen mask or whatever that they give you for laughing gas. And they're like, you've already given birth. And I was like, oh, okay, yeah. But it was, I stood up and I was like, this is how I want to birth my baby. This is the position in which my body can use my upper body strength. My hips could move around. And I gave birth standing up on the hospital bed. And
oh my gosh, I love that.
That was intense.
That's amazing.
Yeah.
You know what to do, though. You felt like this is what I needed to do.
Yeah. First when I was on my back and I was like, this is, and then the big old bulb of light. And I was like,
you're like, this is not how it's meant to be done. No.
I was like, I haven't seen my situation down there in so long. And you guys have like a neon light and 15 people standing here. It was so uncomfortable. So anyway, to each their own. I mean, there's all these ways to give birth and there's all these what feels right and how many births you've had. But that was my experience with Parker.
Wow.
And yeah, it was intense.
That is intense. So, that's amazing.
I probably should have done some pelvic floor in between support.
Yeah.
I just didn't know about it.
Yeah, most people don't. That's the thing. And most OBs and gynecologists don't know what we do either. So they just like don't even know to refer out.
Why?
I think everyone's so busy, right? They're just stuck in their niche doing their everyday job that they don't even realize, I just have to refer out.
Who do you as a PT refer out to? What are your types of referrals out?
We don't really refer out to anything. We can make suggestions, but we don't really refer out.
Like maybe mental health support?
Yeah, we'll suggest things.
Mental health, nutrition.
Yeah, nutritionist, acupuncture. Because they'll be like, how do you feel about acupuncture? I'm like, well, it won't hurt if that's the route you want to go. So we just
okay, so you have 3 biological children.
Yes.
And you currently have your 4th foster baby?
Yes, he's our 4th placement that we've had.
And he's 8 months.
And he's 8 months old.
How did you get into fostering? Tell me about your kids. Tell me just a little about Miss Gina, not Dr. Gina. Let's take your vagina hat off for a minute and talk about being a mom.
I love it. Sitting in church, I have the date written down because I was writing notes in church. August 7th, 2022. There were some guest speakers who were missionaries, a husband and wife. And the sermon was kind of about, it doesn't matter if it's easy. It doesn't matter if it makes sense. But if God calls you to it, he will provide, he will comfort, he will give you peace. And all of a sudden, I felt like the Holy Spirit hit me with that we're supposed to do foster care. So I'm not a crier, but all of a sudden I started crying during service. And then afterwards, my husband's like, well, whatever it is, I support you. And I'm like, well, it's not just me, it's us. And at the time, my youngest is 2. So I have a 2-year-old, a 4-year-old, and a 7-year-old. I already feel like I'm like drowning in motherhood here, like just trying to keep my head above water. I'm like, I don't know how I'm going to do this. I have a baby. I don't know how I'm going to like foster other people's babies, just making it day by day, loving my own 3 kiddos. So it took us a while to fill out the paperwork. It actually took us 2 years to the date when we were approved by San Diego County to be foster parents.
Why?
August 7th, 2024.
Whoa.
Yeah, exactly 2 years later.
Why? Was that a you thing or was that a them thing? Like, why was that 2 years?
Well, we started the process, like the paperwork took us a while, but it wasn't up to us of how long the county was going to take to approve us.
So it was like you did your part and then you were kind of waiting
for the county to approve us. Yeah, so exactly 2 years later. And it took until January until we got our first placement. So January of last year, 2025, is when we got our first placement. Wow. And we had her for 6 weeks. We got her from great aunt. She went back to great aunt. Then we've done respite care, which is awesome. If anyone's interested in that, that is just babysitting for foster families. So if we want to go on vacation, we had respite care for our little guy the first week of June because we were going on vacation. So we've done that also.
Because you can't travel with them.
If it's outside of a neighboring county, you need certain approval to go. And plus the trip we were going was far away. We were going on a boat. It just wasn't like baby friendly trip. So yeah, we had twin 2-month-old baby boys for 5 days. It was a blur. We didn't know what day it was. We weren't sleeping. It was just
5
crazy.
days, twins.
Yeah, 5 days, twins, 2 months old. And we're like, whew, okay. No
Check
twins.
on your twin mamas.
Yes. Be the helping hand. Just go over and hold a baby for her. She will appreciate you.
I got a couple twin mamas in my life and I should reach out to them.
You should. Absolutely.
Hold their babies.
Yes. Then we had a sweet, about 1-year-old little girl. And now this guy, 8 months old. And he's been our longest placement so far.
And you've had him for how long?
Since May 1st. Yeah. Okay. So about 6-7 weeks.
And the goal is reunification.
Goal is always reunification.
Opportunity for y'all to adopt?
If it comes to that, yes. Like if reunification was not a goal for him, that would be the route.
Did you feel that for all of them?
We would, because you just get attached.
Just kidding.
Yeah, probably. You're already so attached. You love these little babies. You're taking care of them 24/7. Like you know them better than anyone. You're with them.
So how did your husband perceive your request? Was he like, that's amazing, let's go get a minivan, or was he like, you're insane, I need a minute?
Yeah, he is the most chill, laid back, amazing husband who would support me no matter what. And he could have 20 kids and be fine. I couldn't, but he could because he's so patient. He these are the rules, we follow the rules, he puts things in order, he's never raises his voice, like he's just phenomenal. And so he was just supporting me 100%. So when I work, the kiddo's with him. So it's a lot on him too.
Does he work?
Yeah, he's a firefighter, paramedic.
Oh.
Yeah. So he's gone for 2-3 days at a time.
Hot diggity dog.
Yeah.
Dang, that's hard for you.
Yeah, yeah.
So you flex your schedule around his, or do you have support?
I have support also. My mother-in-law and my mom.
Did they watch the baby?
They're both approved. Okay, yeah, caregivers. So they've gone through the background checks and the interviews
for any
to help.
Foster baby you have, or each time you have to re-enlist?
No, for any foster baby that comes to our
mom
home.
And mother-in-law?
Mm-hmm.
Oh, dang. That's the key to life and getting those.
You need that support. It takes a village, or else you'd have to put the kiddo in daycare or something.
Which the city will pay.
Yes, which you can.
But that's hard because now you're exposing them to certain things. And
yeah. And so if I didn't have to do that for my kid, I'd try to go to the ends of the earth to not do that with a foster baby for attachment and bonding purposes. And
you have to follow the CDC protocol for them?
Yep.
You don't get a choice? Can you skip an appointment or two? Or will they just re-inject them all at the same time?
They will. Like, even they're like, oh, well, this one he's almost outgrown, so let's do this one. And I'm like, well, if he's almost outgrown it, why does he need it? But I try to like push them off to where they're not even with me anymore by the time they need them, because I've only had a short-term placement.
Yeah.
So.
But your kids are clear. They don't have them?
Oldest has all, middle has till 1, and youngest has none. You know, as your mom, your knowledge changes.
You grow and you learn.
And you learn. So my youngest has none. He's just a tank of a boy. He's like the most amazing little thing. They're all healthy. I have 3 healthy kids, which is amazing.
That's amazing.
3 healthy babies. But.
Yeah, she told me that she told me the name of her school, and I was like, sounds like a co-op. We don't have to say it here because it's too public, but I was just like, that is so funny. I'm sure she co-ops her kids. I mean, California, Texas is very different. We can write affidavits for all of our kids. We can put them in any school program, camps, or whatever. And I have like 10 copies of affidavits for all of us, and they're accepted anywhere. They just get notarized, and they're 2 years clean. Yeah. 2 years of notaries and affidavits work in Texas, and it's amazing. So
that is so amazing. You just go to Arizona, and they don't even ask for them. It doesn't even matter.
Right. And then California is like, no affidavits. Like, this is what we've deemed what we want. And so if you don't comply, then your kids need to be schooled elsewhere. So you can kind of sift through a little bit of the wheat here in lifestyles because of where kids go to school, which is kind of cool. I mean, you can create community with like-minded people.
Absolutely.
I'm sure there's judgment and a lot of misinterpretation or understanding, but would you give me why you came to that knowledge from all, some, none? How you got to that? Like,
it was just pretty much
original was like you just kind of went for what you were told.
Oh yeah, your first baby, you don't know. You go to every wellness visit, and they're just telling you all the things, and so you just do what they say.
And then the next one, you're like, maybe not so much.
Yeah,
maybe I'm just gonna space them out a little. I'll just take you a little less here and there.
Yeah.
So the problem though is if you do that. If you like, let's say you miss your 6th month and then you're supposed to go back at your 9 or your 12 or whatever. I don't even know. You don't do it. So, let's say it's that order, 6, 9, 3, 6, 9, 12.
Yeah.
You miss your 6. Well, when you come to your 9, they want to back stock.
Yes.
And give you the 6 and the 9 on the same appointment. And I think that's where we get into the most detrimental part of our bodies being subjected to some of these chemicals so abruptly, so many, and your body just can't regulate that. And that's where I think we fall into some issues. So again, I'm not a doctor, she is, but we're not talking in medical terms here. We're just sharing. And just, again, all this goes back to is just advocacy, knowing what you are doing for yourself and for your children. And if you support it, by all means, that's your choice. And if you don't, know your space, know your right, find your people, find your community, get your evidence, and just say, hey, this is where I'm at. And people should respect that. So it's kind of cool that you have all 3. They're all healthy. So it doesn't really matter.
Right.
If you've started and you want to change your mind, you can still, there's detox programs or just eating healthy and lifestyle changes that you can make if you want to go kind of back and say, hey, you know what, let's revisit this topic. So I'm going to get off my soapbox there for that. But so you have this little baby. How do your kids handle foster?
Yeah, that's a good question. They love every child we have. Well, the first placement, my youngest had a really hard time. He cried himself in the corner because he's my baby and he is mama's boy to the max.
And you had a little girl.
And we had a little girl. So even him waking up out of bed and I have her on my lap, but he's used to crawling onto my lap. And at the time he's 4.
And you had her 6 weeks?
I had her for 6 weeks.
Okay.
So I had to like make sure she was not on my lap so I could like embrace him and just finding that balance. Now that he's older, he is all about it. He loves it.
How old is he now?
5.5. It's my youngest.
Oh, okay. 5.5, 7, and 9? Or 10.
Yeah.
5, 7, 10. And the older 2 are boys? Or
girl, boy, boy. Girl, boy.
And bonus boy.
And bonus boy right now. Yes. So a little chunky man.
So fun.
So they love him. And when they reunify, we try to act like it's a celebration. Because of course we are all boo-hooing and we are all so sad. And it's hard on our hearts. So hard. but we go get frozen yogurt and we say that we're happy he's back with his mommy, daddy, aunt, uncle, grandma, whoever they end up going with. So,
would you guys ever consider full-on adoption from this point? Or are you just kind of open to fostering and you're in that season? And if adoption came up through a foster, you're for it, but you're not going to seek out adoption.
Correct. We're not going to seek it out. My dad was adopted, so it's kind of like, we have so much love, right? We have so much love. We have so much support. And we just want to be able to share that. But it's like God knows each placement that comes into our home. And we pray for each placement that comes into our home that if it leads to adoption, that's great. And if it doesn't ever, that's okay too.
There's a special mindset. And I think they train you this way in foster system, just to kind of, the goal is always reunification. The goal is always reunification. If you haven't heard that term, that's probably because you haven't really been exposed to that world where you're just looking at somebody like, how the heck could you bring in a baby and love it and then send it back to an environment sometimes that you're like,
I know.
Oh man, what bad. We could do for this child and what we're giving them back to is, I mean, that's the fine line of this whole system. It's like, you can provide more, but biological is sometimes they say is best. And even though from our perspective, we're like, I don't know, like that doesn't look like the best treatment or the best situation for that child. What we can give them feels so much better. But again, there's cultural differences and racial things. And so you never really know, but reunification really is the goal. I do think you have to have the heart for it. And I am guaranteed I have that heart. Like I know without a shadow of a doubt that I can truly, fully love somebody in a moment for a season for as long as I can and as deep as I can. Like there's no limit or no like reservation in my heart to just fully love someone else's child. Like if I see somebody on the park's kid get hurt, like I just love, like I am fully love for people. And I would love to foster. I would love to adopt. My husband thinks we got our hands full. And people say it every time. Like I took my girls to the store, we went grocery shopping, and they're like, your hands are so full.
I know.
And I was like, well, you want to help? You're like, thanks for the observation. Yours are not. So grab the cart.
Right. Help me out.
Like, I don't know if you're judging or supporting me, but here's one.
Right.
Grab
oh my
chips.
gosh. I know.
But I think that, we're just kind of praying through if our family's complete. 3's an awkward number.
3 is an awkward number. If I could have more, I would. I would. Absolutely.
Can you not?
Well, okay, here's the story. You ready?
Yeah.
We're bringing Mercier Therapy and we're bringing everything together. So we had 3. We're like, our family's done. Our family's complete. Like, this is amazing. But I did the Mercier class in Illinois. So we're practicing on each other, right? We're doing all of the work over uterus, ovaries. We're practicing on each other. So increase your fertility, right? Well, then I got pregnant right after the course.
Of course you did.
But it was so really
Did all the girls in your class, they're like, everyone's going to get knocked up. No diplomas.
Yeah.
Here's a pregnancy test.
Well, the cool thing is that I met my best friend out there who is a pelvic floor PT also. We both did the course together. And she had hemorrhaging after her second child. And so the ER doc did DNC to like clean everything out of her uterus. She ended up having major scar tissue, Asherman syndrome. So her periods are so painful because when the uterus contracts, it's like stuck together. After Mercier Therapy, she didn't have to take ibuprofen anymore. Her periods were so much better. So it helps with the scar tissue. For me, I got pregnant. Total surprise. All 3 of my kids were planned. Total surprise. Well, it ended in miscarriage 5 weeks later. And that would have been our 4th. And so we kind of freaked out. It was like hemorrhaging, hospital, like the whole thing. So because it was such a scary process for us, we just kind of, without praying about it or considering anything, my husband just got a vasectomy.
Oh.
And then, because we thought our family was complete. My youngest was only like
They're
1.5. I know. No.
I have a friend, I'm going to interview her when I get back to Texas. Her husband had one and they reversed it. And they just had their 4th, their baby boy.
Yeah. I feel like 4 is a good number.
4 is a good number. My husband's like, it's so chaos. It's so crazy. And I was like, so then what's one more?
Yeah.
You know what I mean?
Add another one to the mix. You're never going to regret having more.
I know that. But here's where we're at in our faith journey. It's like, I'm at the hem of Jesus's garment. Like, I cannot make this happen. I can't, other than surrendering to God. And maybe you can like go get some gloves and like.
I don't need gloves for Mercier. You're just going to lay down. I'm going to work on
we're going to Mercier this.
Yes,
Jen will
we
take
are.
some pictures. But
yes.
I'll let you guys get back to your walking or whatever you're doing on the other side of that screen. And maybe you're Kegling. I don't know. But I'm going to let you guys go so I can Mercier with my new friend, Gina.
Yes.
But, you know, we want more. I want more. I desperately want more. And I think my husband vacillates between yes and no. And I just think he sees me. He travels a lot. So I'm alone with the girls a lot, which is why we're here. I would have been alone all summer in Texas, you know, and
wow.
That's not fair to me. That's not fair to our girls. Like, he was gone for 4 days and they missed him. Like, when he walks in the door, he is the love of their, like, the apple of their eye, like daddy's girls through and through.
Oh, I love that.
And so I think for him, he's probably trying to protect my heart and just saying, like, I can't give you one more thing to, I mean, nursing. You know, I nursed my oldest for 2 years.
Yeah.
He's like, listen, if she can eat that chicken nugget over there, she's done. And I was like, I know, but it's our only one. And we had 3 miscarriages. And I was like, I can't. If I get pregnant, and he's like, maybe stop and we'll get pregnant. But I nursed for so long. And it's just, there's something to me. I would love to adopt. Like, I would love to just get that baby and love it. So I don't have to be pregnant, nurse the baby, stand up, give birth, like all the craziness that we go through.
Yeah.
But I'm going to just trust God, and I'm going to lay at the hem of his garment until whatever this longing of my heart is healed. Whether it's healed because he's like, this is complete, or this child is coming, or you will have another. But like, I'm just literally at the hem of his garment saying, here I am, Lord, whatever you have for me, I want to honor. But I'll tell you the truth. I get pretty sad. I bought a box of tampons and a pregnancy test. And like I said, only one of them is going to win. And right now it's the tampon. Yeah. And I don't have the answer for what God's plan is, but I do have the faith. And I'm going to get some Mercier.
Yeah. Yeah.
And we're just going to pray through and see what the Lord has for us. But I loved having you on. This was so fun.
So fun. Thank you so much for having me. Thank you.
If you're watching, comment in the comments below, Kegels. Just kidding. You know those YouTube channels? Comment below.
Subscribe below.
Like and subscribe. Comment Kegels and we'll send you our free guide.
Yes.
Kegels. Is that like a Kegel thing?
Yeah, sure. Or like, I'm going to tickle you.
Get your gloves.
Get your gloves on.
We're out. Love you, girls. Bye.